Pop quiz. You're taking your vitamin D supplement every morning with your coffee. Gold star for remembering, right? Wrong. You just flushed 70% of it straight down the toilet, literally. Your body didn't absorb it. And that expensive bottle you bought at Costco might as well be candy. I'm going to let you in on something that drives me absolutely nuts as a physician. The vitamin D advice floating around out there is about as useful as a screen door on a submarine. Everyone tells you to take it. Nobody tells you how to actually make it work. And trust me, the how matters more than you think. Stick with me for the next few minutes, because I'm going to show you exactly why your current routine is sabotaging your bones, your brain, and quite possibly your mood. But more importantly, I'm going to fix it. Let's start with the biggest mistake I see in my practice, and I see it every single day. You're taking vitamin D by itself, just the pill, nothing else. Pop it in your mouth, wash it down with water, and you're done. Feels responsible, doesn't it? Here's the problem. Vitamin D is fat-soluble, not water-soluble like vitamin C. Fat-soluble. That means it needs fat to hitch a ride into your bloodstream. Without fat, it's like trying to mail a letter without a stamp. It's not going anywhere. Your intestines can't absorb vitamin D unless there's dietary fat present. And no, the microscopic amount of oil in the gel cap doesn't count. You need actual food-based fat. We're talking a tablespoon of olive oil, a handful of nuts, a slice of avocado. Heck, even a piece of buttered toast works. Take your vitamin D with breakfast that includes some healthy fats, and suddenly your absorption rate jumps from 30% to nearly 90%. Same pill, same dose, triple the benefit, all because you paired it with scrambled eggs instead of black coffee. But wait, it gets better, or worse, depending on how you look at it. The second massive mistake, you're taking it at the wrong time of day. I know what you're thinking. Does it really matter if I take it in the morning versus the evening? Yes. Yes, it does. And here's why. Vitamin D plays a significant role in your circadian rhythm. That's your body's internal clock, the system that tells you when to be awake and when to sleep. When you take vitamin D late in the day or at night, you're essentially telling your brain it's daytime. Your melatonin production drops, your sleep quality tanks, and then you're wondering why you're awake at 2 in the morning staring at the ceiling. Studies show that people who take vitamin D in the evening have measurably worse sleep than those who take it in the morning. We're talking about 45 minutes less deep sleep on average. That's not nothing. That's the difference between waking up refreshed and waking up feeling like you got hit by a truck. So rule number 2, take your vitamin D in the morning, with breakfast, with fat. Write it on a sticky note if you have to. Now let's talk about the third mistake, and this one's a doozy. You're taking way too little, or way too much, and you have no idea which one it is because nobody's actually checking your levels. The recommended daily allowance for vitamin D is 600 to 800 international units for most adults. Sounds official, right? Government approved. Must be correct. Except that number was calculated to prevent rickets, a disease that makes children's bones soft. It was never designed to optimize your health as an adult. Most integrative medicine doctors and researchers now believe the optimal range is somewhere between 2,000 to 4,000 international units per day for adults over 50. That's 2.5 to 5 times higher than the official recommendation. Why? Because we're not just trying to avoid disease, we're trying to thrive. But here's the catch. Some of you need more, some of you need less. It depends on your starting level, your body weight, your sun exposure, your genetics, and about 15 other factors. The only way to know for sure is to get your blood tested. Ask your doctor for a 25-hydroxy vitamin D test. Not just any vitamin D test. The 25-hydroxy version. That's the one that actually tells you what's circulating in your system. You want your level to be between 50 and 80 nanograms per milliliter, not 20, not 30. Those levels might keep you out of the danger zone, but they're not going to help you feel your best. And if your doctor says your level is fine at 25, get a second opinion or show them the research, because fine and optimal are two very different things. Let me tell you about Margaret, 72 years old, Came to see me complaining about bone pain and fatigue. Said she'd been taking vitamin D for 3 years, 1,000 units a day. Never missed a dose. Her level? 18. 18. Despite 3 years of supplementation. Turns out she was taking it at night with a glass of water. No food, no fat. Her body was treating that pill like a tourist without a passport. Thanks for visiting, now get out. We switched her to 4,000 units in the morning with breakfast. Tested her again 3 months later. Level was up to 62. The bone pain was gone. Her energy was back. Same vitamin, different strategy, life-changing results. Here's mistake number 4, and it's a sneaky one. You're not taking vitamin K2 with your vitamin D. Never heard of K2? You're not alone. Most people haven't. But if you're taking high doses of vitamin D without K2, you're doing your arteries a disservice. Here's the deal. Vitamin D helps your body absorb calcium. That's great for your bones. But if that calcium ends up in your arteries instead of your bones, you've got a problem. That's where K2 comes in. It activates proteins that shuttle calcium into your bones and teeth and keeps it out of your soft tissues and blood vessels. Think of vitamin D as the foreman that brings calcium to the construction site. K2 is the supervisor that tells the calcium exactly where to go. Without K2, the calcium just piles up wherever it feels like it, including places you really don't want it, like your coronary arteries. The research on this is pretty clear. People who take high-dose vitamin D without K2 have higher rates of arterial calcification compared to people who take both together. It's not a huge effect, but why take the risk? K2 supplements are cheap. Most combination supplements include both these days anyway. Look for vitamin K2 in the MK7 form. That's the one with the longest half-life in your body. You need about 100 to 200 micrograms a day. And yes, take it with fat too. It's also fat-soluble. Are you sensing a theme here? Now we get to mistake number 5. You're taking your vitamin D with your morning calcium supplement. I see this all the time. People take their multivitamin, their calcium, and their vitamin D all at once. One quick gulp, very efficient, also very counterproductive. Calcium and vitamin D compete for absorption in your gut. When you take large amounts of both together, you're basically making them fight over the same transport mechanisms. Neither one gets absorbed as well as it should. It's like trying to fit 2 people through a doorway at the same time. Sure, it works eventually, but it's slower and more awkward than it needs to be. Space them out. Take your vitamin D with breakfast. Take your calcium at lunch or dinner. Better absorption for both. Simple fix. Mistake number 6. You're buying the cheapest bottle on the shelf. Look, I get it. Vitamin D isn't expensive to begin with. Why pay more? Because quality matters. A lot. The supplement industry is barely regulated. Companies can put almost anything in those bottles and slap a label on them. Studies have found that some vitamin D supplements contain 50% less than the label claims. Some contain almost none at all. You're literally paying for chalk. Third-party testing matters. Look for supplements that have been certified by USP, NSF, or Consumer Lab. These organizations actually test what's in the bottle and verify it matches the label. Yeah, it costs a few dollars more, but at least you know you're getting what you paid for. Also, pay attention to the form. Vitamin D3, also called cholecalciferol, is significantly more effective at raising your blood levels than vitamin D2, or ergocalciferol. D3 is the form your skin makes when exposed to sunlight. D2 is the synthetic form often used in prescription supplements. If your doctor prescribes you 50,000 units of vitamin D once a week and it's D2, ask if you can take D3 instead. Daily D3 is more effective and easier on your system than weekly megadoses of D2. Here's mistake 7, and this one surprises people. You think sunshine is enough. Let me be clear, sunshine is fantastic. It's the original and best source of vitamin D. Your skin is incredibly efficient at making it when exposed to UVB rays. But here's the reality. If you're over 50, you're probably not making as much as you think. As we age, our skin loses its ability to synthesize vitamin D efficiently. A 70-year-old produces about 75% less vitamin D from the same amount of sun exposure compared to a 20-year-old. Your skin just isn't as good at the job anymore. Plus, you're probably wearing sunscreen, which you should. Skin cancer is real and dangerous, but sunscreen with an SPF of 30 blocks about 97% of UVB rays. No UVB, no vitamin D production. You can sit in the sun all day, slathered in SPF 50, and your levels won't budge. And if you live above the 37th parallel, roughly the latitude of San Francisco or Richmond, Virginia, you're not getting enough UVB radiation from October through March to make any meaningful vitamin D. The sun angle is too low. The rays pass through too much atmosphere. It doesn't matter how much time you spend outside in January. Your body isn't making vitamin D, so yes, get outside, enjoy the sunshine, but don't assume it's covering your needs, especially if you're using sunscreen or living anywhere that sees winter. Mistake number 8. You're taking vitamin D but ignoring magnesium. These two are like Batman and Robin. Vitamin D can't do its job properly without adequate magnesium. Every single enzyme involved in vitamin D metabolism requires magnesium as a cofactor. Without enough magnesium, your body can't convert vitamin D into its active form. And guess what? Most people over 60 are magnesium deficient. We don't eat enough leafy greens, nuts, and whole grains. We take medications like proton pump inhibitors that reduce magnesium absorption. Our kidneys get less efficient at holding onto it as we age. If you're taking vitamin D and your levels still won't budge, check your magnesium. Better yet, just supplement it. You need about 300 to 400 milligrams a day. Magnesium glycinate is the easiest on your stomach. Avoid magnesium oxide. It's cheap but poorly absorbed and will give you diarrhea. Trust me on that one. Now for mistake number 9. You stop taking your supplement in the summer because you're outside more. I hear this constantly. People tell me they only take vitamin D in winter because they're outside more in summer. Makes sense, right? Except your summer levels don't carry over into fall and winter. Vitamin D has a half-life of about 2 to 3 weeks. That means every few weeks you're losing half of what you had. By the time December rolls around, that robust summer level has crashed. You're starting winter from zero instead of maintaining a steady baseline year-round. Keep taking your supplement even in summer. Maybe reduce the dose if you're getting significant sun exposure without sunscreen. Say 15 to 20 minutes on large areas of skin several times a week. But don't stop completely. Consistency matters more than you think. Mistake number 10, and this is the last one. You assume symptoms of deficiency are just normal aging. You're tired all the time? Well, you're 70. Of course you're tired. Your bones ache? That's just arthritis. You're feeling down? That's just life. Except maybe it's not. Vitamin D deficiency looks a lot like normal aging because it causes many of the same symptoms: fatigue, muscle weakness, bone pain, balance problems, mood changes, even cognitive decline. Studies show that seniors with vitamin D levels below 20 have double the risk of falling compared to those with levels above 30. They have higher rates of depression, faster cognitive decline, more infections. These aren't separate issues. They're all connected to inadequate vitamin D. The tragedy is how many people suffer through these symptoms thinking it's inevitable when a simple blood test and a cheap supplement could change everything. I've seen patients transform their quality of life by optimizing their vitamin D levels. More energy, better mood, stronger bones, fewer falls. It's not a miracle cure, but it's pretty close. So let's recap everything we've covered because this information only helps if you actually use it. Take your vitamin D with a meal containing healthy fats. Morning is best. Get your blood levels tested and aim for 50 to 80 nanograms per milliliter. Take vitamin K2 alongside it to keep calcium in your bones and out of your arteries. Space it apart from calcium supplements. Choose D3 over D2 and look for third-party testing. Don't rely solely on sunshine, especially if you're over 50. Make sure you're getting enough magnesium. Keep taking it year-round. And don't write off symptoms as just aging without checking your levels first. That's it. 10 mistakes, 10 solutions. None of them are complicated. None of them are expensive. But together, they can make the difference between barely functioning and actually thriving in your senior years. Your bones deserve better, your brain deserves better, you deserve better, and now you know exactly how to make it happen. If this video helped you understand vitamin D better, consider passing it along to a friend who might need to hear it. And if you want more straight talk about health topics that actually matter, there's plenty more where this came from. Now go take your vitamin D the right way, with breakfast. This time tomorrow, your body will thank you.